He said he could feel metal inside his body. No one believed him, until the X-ray revealed 130 needles. In the rural heart of India, a 56-year-old man lived with a pain no one could explain. See, it wasn't a fever. It wasn't an infection. There were no visible wounds, no cuts, papus. But he swore there was something inside him. Something sharp. Something cold. Doctors suspected everything. Hypochondria, depression, maybe even malingering. They gave him painkillers, prescribed rest, and when that didn't help, they said, "It's all in your head." But the pain, it wouldn't stop. It grew. It shifted. It got worse at night, until one day, fed up with being ignored, he demanded an X-ray. What the doctor saw made the air vanish from the room. Scattered across his body, from shoulders to thighs, were dozens of metal needles. Some were rusted, others bent, a few alarmingly close to vital organs. 130 needles, inside a single man. Who did this to him? Was it a crime, a punishment, or something even darker? This story will take you to the edge of pain, memory, and what the human body can silently endure for decades. If you're drawn to true cases that challenge everything modern medicine believes, get ready. Subscribe to Medical Mystery Files. What you're about to hear isn't just a case. It's a scream buried in flesh. He was an ordinary man. Hardworking, quiet, living in a small village in northern India. He didn't drink, didn't smoke, spoke very little. He lived with his elderly father and worked as a night watchman. That's how the pain began. Silently, like nighttime whispers that refused to go away. It started in his leg, a sharp sting, as if something was pricking him from the inside. Then, his left shoulder, his neck, his hip. Different places, same kind of pain, sharp, localized, and unexplainable. At first, he ignored it, thought it was tension, maybe overexertion. But when he started waking up in the middle of the night, sweating cold and digging his fingers into his skin like he was trying to pull something out, he knew it wasn't normal. He went to the local clinic. The doctor examined him for less than 5 minutes, said it was stress, prescribed painkillers, told him to rest, but his body was screaming, and no one was listening. Over time, neighbors started whispering, "He complains too much. It's all in his head." Even his own father began to doubt him. "You're making up illnesses to avoid work, aren't you?" The loneliness of the symptom turned into a silent desperation. He could no longer sit for long or walk without feeling like nails were stuck beneath his skin. He tried to explain. But how do you explain a pain no one can see? How do you convince someone that something is hidden inside your body when not even the doctors believe you? That's when the thought crept in. What if the problem is me? Am I going insane? But something was even stranger. The pain wasn't random. It seemed to follow a pattern. It moved inside him, like something was actually in there, shifting around. That feeling, that was what pushed him over the edge. He went back to the hospital, but this time, he didn't ask. He demanded. Said he wouldn't leave without imaging tests. Said he couldn't take it anymore. That he was ready to rip his own flesh off if that's what it took. The doctor, maybe out of fear or just wanting to be rid of him, gave in, ordered an X-ray of his pelvic region. And at that moment, that exact moment, everything changed. The technician looked at the digital scan, furrowed his brow, called the doctor. The doctor looked, and his eyes widened in shock. This couldn't be right. The image was full of metallic shadows. Straight, long, definite. They repeated the scan. From a different angle, with different equipment. And there they were. Needles. Metal needles inside that man's body. It was impossible. It was absurd. But it wasn't a mistake. Something, or someone, had put dozens of them inside that body. And that was just the first image. In the cold hospital room, the silence was almost as sharp as what the X-ray had revealed. The doctor held the image with both hands, as if it might slip away. There they were, metal needles, at least 20, visible, clear, aligned in different parts of the body. And that was only the beginning. Is this a fake?" one of the technicians murmured. They repeated the scan. Then another. Used different equipment. Compared the images. There was no mistake. Inside that man's body were real needles. And not small ones. Some were over 2 inches long. Spread across his thighs, groin, hips, abdomen, arms. And they hadn't even scanned his torso or head yet. The first question that echoed among the doctors was obvious. Was this an assault? Was it torture? A deliberate attack? A slow attempt at murder? But there was a problem. Actually, several. There were no scars. No visible entry points. No external signs that could explain the insertion of so many needles through violence. And, stranger still, the patient was lucid, calm, surprised, but not in shock, as if he already knew or at least suspected that something was in there. They began asking, "Did someone hurt you? Was this part of some ritual? Do you remember anything?" He shook his head, confused. "I don't know. Sometimes I have dreams, images from childhood, but I don't know if they're real." The hospital decided to admit him. It didn't seem possible for someone to walk around with rusted needles inside their body without developing serious infections. And yet, he was alive. A mild fever, but alive. They started running CT scans, ultrasounds, MRIs, and the more they looked, the more they found. Needles in the muscle, between vertebrae, some bent, as if they'd been pressed from the inside, others still intact, and one dangerously close to the bladder. The total count, 130. 130 metal needles, spread out over decades, according to the test results. Some were encapsulated by scar tissue, the body's way of protecting itself by isolating foreign objects. Others were in more recent zones, with visible inflammation. What the doctors now knew was only the how many. What they didn't understand was the how, and more importantly, the why. No conventional explanation made sense. No one inserts 130 needles into a body by accident. No one goes through that kind of trauma without leaving visible marks. The team began exploring hypotheses. One possibility, self-harm. But he denied it. No psychiatric history, no signs of self-injury. And let's be honest, how could someone insert needles into their own back, thighs, and shoulder blades without help? Another theory, ritual or religious punishment. But there were no records of such practices in the village, and the man didn't belong to any known cult or sect. Finally, childhood trauma. The idea came from a young resident who noticed the man's confused statements about childhood dreams. What if he was a victim as a child? What if he forgot? The question hung in the air. The only certainty was that this body held a story. A story the man himself seemed not to remember, but the body remembered. The pain, the inflammation, the internal marks were fragments of a buried memory. And now, the doctors weren't just dealing with a diagnosis. They were facing a mystery. A body speaking without words. A pain deeper than physical. And a lifetime spent trying to hide or forget something no one should ever endure. A body doesn't lie. It can stay silent for years. It can hide, resist, shut down. But one day, it speaks. And when it does, it screams. That's what the doctors understood as they mapped, one by one, the needles inside that man's body. Some were regular sewing needles. Others, thicker, seemed handmade. Almost all were rusted. More than half had already fused with muscle tissue. At least 10 were dangerously close to major blood vessels. And one, the most terrifying of all, was just millimeters from the colon. Had it pierced through, sepsis could have been fatal, but he was still alive. And that, perhaps, was the greatest anomaly of all. Multiple specialists were called in. Orthopedists, surgeons, infectious disease experts, even psychiatrists, all trying to make sense of it. In silence, that body seemed to say, "Someone hurt me, many times, and I survived." The doctors decided not to remove all the needles. It would be impossible. Too many had fused to tissue, and the risk of damaging nerves or organs was too high. They would only remove the critical ones. But first, they needed to piece together the puzzle. They began estimating the timeline of each insertion based on calcification, scar tissue, and inflammatory response. They determined that some needles had been there for over 30 years. This started when he was still a child, one of the surgeons said. That sentence marked a turning point, because from that moment on, the case was no longer just medical. It became human. A psychologist specializing in complex trauma was brought in, and through long, silent, fragmented sessions, clues began to surface. The patient, who until then had seemed merely confused, began to remember. Not clearly, but in flashes. He remembered a dark room, an adult, a voice telling him to stay quiet, pain in his legs, then a heavy sleep, like blacking out. He remembered a woman, maybe his mother, crying. He remembered a wet cloth on his forehead and the sound of something metallic falling to the floor. These fragments were hazy, but consistent. A pattern began to emerge, and the cruelest part, the patient began to realize that perhaps for years he had ignored his own trauma. Maybe he had learned to live with the pain, to accept it as part of his body, as if that violence had become routine, and the body simply went silent, until it couldn't anymore. Doctors reviewed his history. They interviewed his father, an elderly man, confused, showing signs of dementia. But one phrase he let slip in the middle of a conversation chilled everyone on the team. He was little, always sick. We used to take him to a healer, one of those who draw out the evil with hot iron. That sentence opened a new line of investigation. Decades ago, in that village, there had been primitive and brutal practices to treat what they called spiritual illnesses. Some healers used iron objects, including needles, to drive out evil spirits. They inserted them into children's bodies, claiming it sealed the evil inside. Other times it was simply punishment, a way to silence. No one knew for sure, and no one wanted to take responsibility. But what was undeniable was what lay inside that man. It wasn't just metallic, it was emotional. It was ancestral. 130 objects telling a story of pain, silence, and forgetting. And now, each one of them was also a question. Who was truly responsible? And why did he never speak up? But the most chilling answer was still to come. Because not everything had been done by others. Some of the needles were in places only he could have reached. The sessions with the psychologist continued. Slowly, the memory flashes began to take shape. They weren't full memories, they were fragments, visual, sensory, emotional. But each fragment seemed to hold a piece of the puzzle. He remembered hands holding down his legs. He remembered needles being heated in fire. He remembered someone's voice saying, "If you cry, the evil comes back." He was a child, too young to understand, too old to ever forget. And then came the most devastating memory, not of when the needles were put in, but of when he himself began inserting them. It was hard to accept, hard even to comprehend. But the psychologist explained, deep traumas, especially those experienced in childhood, can shape self-harming behaviors in adulthood, often without full awareness. Some patients, survivors of abuse or extreme rituals, repeat the same patterns as a way of regaining control, an unconscious attempt to dominate what once dominated them. In his case, there were signs of this. Some of the needles were placed in spots that required precision, carefully inserted into areas that suggested experience. He denied it. He cried. He became angry. But little by little he began to accept the possibility that a part of him, dormant, hidden, wounded, might have sought out pain as a response to pain. It wasn't madness. It was survival. He grew up believing that pain was normal, that he deserved it, that it was part of who he was. His childhood wasn't made of toys and laughter. It was made of silence, fear, and iron. As a teenager, He tried to explain the pain, but no one listened. So he learned to stay silent. His body became the hiding place of his trauma. With each needle, a memory was buried. With each piece of metal, a part of his childhood was buried deeper. And now, decades later, the flesh was screaming what the mouth never could. The doctors, who at first saw this case as a physical phenomenon, now saw it through different eyes. This wasn't just medicine. It was psyche. It was chronic pain born of the soul. It was proof that an untreated trauma can manifest in every cell, every bone, every gesture of the body. The case was documented as one of the most extreme examples of self-implantation associated with dissociative disorder and childhood trauma. But for him, it wasn't a diagnosis. It was his life. And now, for the first time, he was beginning to understand what he had lived through. To accept that it wasn't his fault, that no one deserves to carry the weight of pain alone, and that sometimes the body bleeds what the mind can't scream. At the end of one of the removal surgeries, one doctor wrote a note in the file, a line that would never be forgotten. "This body is not a medical mystery. It's a delayed cry for help." And there was still one final piece missing, a single needle, the one buried deepest of all. It was there, deep in the left thigh, wedged between muscle fibers and ending near the sciatic nerve. The team hesitated. It was risky to touch, but it caused constant pain. It throbbed, as if it pulsed with every heartbeat. The final needle. Unlike the others, this one seemed older. It was deformed, wrapped in scar tissue, partially rusted. But still, it hurt, like a poisoned thorn. Not just physical, psychological. The patient asked for it to be removed. "I want it out of me, all of it. Even the last one." The surgery was scheduled. Technically, it was simple, but symbolically, it meant everything. Anesthesia was applied. The incision was made with care. The surgical clamp slid in until it reached the metal. And then, silence. The doctors removed the needles slowly, as if they were extracting something sacred. In the room, no one spoke. Even the instruments seemed quiet. When the patient woke up, he knew. It was gone. Not just the needle. Something else, he cried. For the first time since it all began, he cried like someone cleaning a wound that had been open for decades. In the days that followed, something changed. His posture, his eyes, the way he breathed. He still felt pain, of course. Many needles remained inside. But now, he knew why, and that made all the difference. He began ongoing therapy. Started attending a support group. He shared his story with other survivors of physical and emotional trauma. The case was presented at medical conferences, studied in scientific journals, even cited in psychology courses. But to him, it was just his life. And for the first time, he could tell it, without using his body as paper. The last needle removed became a symbol. It was placed in a small glass vial, sealed with a simple label. Memory is not condemnation. It is liberation. And in that small piece of iron, there was more than pain. There was story. There was truth. There was redemption. Because for 56 years, his body had been trying to speak. And now, someone finally listened. 130 needles, a shattered childhood, and a body that learned to suffer in silence. For decades, he carried each piece of metal as if it were a part of him, because it was, not just in the flesh, but in the soul. Medicine looked at him as a mystery, but behind the rare diagnosis, there was something deeper, a muffled scream, an unnamed trauma, a silent cry for help. How many people live like this? How many pains are labeled psychological when, in reality, they're memories, screaming for attention? This man survived, but not because he was strong. Because, finally, someone chose to listen. Maybe the greatest mystery in medicine isn't found in scans or symptoms, but in what's left unsaid. In the pain the body carries when the mind can no longer bear the weight. What if it were you in that hospital bed, feeling metal beneath your skin, hearing that it's all just in your head? This story is a warning. Not all pain is visible. Not all trauma bleeds on the outside. If this story moved you, if you believe medicine should see more than just images, subscribe now to Medical Mystery Files. Here, every case is real. Every pain has a name, and everybody holds a secret waiting to be revealed.